Everyone. Welcome to this webinar from the Medical Schools and Dental Schools Council. If you are expecting to come to a webinar saying what to do if students don't receive an offer, definitely in the right place. I will just wait for that number at the bottom of the screen to click up a little bit, and then we will get going. Still a few people joining, so I'll just hold fire for a little bit until I see the little pause on that number, and then we'll get going. Okay, I think we're there. So yes, welcome, very warm welcome to this webinar. If we move to the next slide, I'll let you know what we're doing today. So this is the welcome section, and then I'm going to introduce our panel to you. We've got a really good panel today. They've got some presentations for you, and then there will be a chance for you to ask us some questions. So if we move to the next one. So for this webinar, I know they all work differently, but for this one, you'll see that at the bottom of the screen, you'll see there's a little icon saying Q&A. Please put your questions in there. I won't ask them while people are speaking, but once we finish the presentations bit, I will put those questions to the panel. You'll also see that there's a chat function. That's if you want to comment or ask for information or tech support. I would say that we will also be using that chat function. If the panelists mention a resource, we'll try and find it and put the link in there for you. And as with all MSc and DSc webinars, it will be recorded and available on the MSc YouTube channel. So we have a new channel in there. So please do go and check it out, because it won't just be webinar recordings. We're going to put other resources up there. And so introductions. So my name's Clare Owen. I primarily work with the Medical Schools Council, where I'm a director. And on the panel today, we have Mandy Hampshire from Nottingham Medical School and Raya Verdi from Manchester Dental School. So we've got medicine and dentistry represented here. Lots of good experience on the panel. Next. So today we're going to talk about waiting lists and clearing, graduate entry medicine and dentistry, some of the alternatives to medicine and alternatives to dentistry. Next. Okay. And actually, there is one thing that I'm going to ask Joanna to do. She's helping me with this event today. We have some social media for medicine and dentistry across a number of different panels. It's at Studying Healthcare. We'll be doing lots of updates on there. So if you did want to give that a follow, please do. And we'll put the at. I'm pretending I know how social media works, but I'm hoping Joanna will put the links in for me in the chat. Far too old for this. Brilliant. Now I've embarrassed myself. We will move on to the presentations, and Mandy, I think you're going to start.
Yeah. Just tell me if you can see my slides.
Yes, brilliant. Working very well.
Great. So I'm Mandy Hampshire, and I'm Director of Admissions for Medicine at the University of Nottingham. And I'm delighted to be here with you today. I'm going to focus on medicine, but a lot of what I say would also be very relevant for dentistry. But I have to admit that my area really is medicine. But I am very aware that many of the things that apply to medicine also apply to dentistry, and they're both very competitive courses. Okay. There we go. So I'm going to be talking about waiting lists, UCAS extra and clearing, what to do on A-level results day, and then graduate entry medicine. And then I'm going to hand over to Raya. So we're thinking about what to do if applicants don't have an offer. So I think there are three fairly common scenarios at this point in the admission cycle. One is that if applicants have not had an interview, so they've not got as far as the interview stage and been rejected or made an alternative course offer. And I think it's important to remember that medicine and dentistry are very competitive, and I wouldn't want applicants to think that this means that they really shouldn't do medicine or dentistry. If it's their passion and you've supported them and have academic GCSE grades that might put them in a position to be able to apply, and they've really thought through this is what they want to do, I wouldn't want them to be put off. It may just be that they need to apply again the following year, and we'll talk about that in a bit more detail. So another position maybe is that they've had an interview and been rejected or made an alternative course offer. And I guess that will also be disappointing for them, but it's not necessarily the end of the story. And that's where waiting lists and other options come in, and I'll explain those in more detail. And then I think a third scenario is that they've had an interview and been made an offer, but then they don't get the grades on A-level results day and what to do next and how best to advise them. So I will talk about A-level results day as well. So waiting lists have a number of names. They're sometimes not an actual kind of list, an ordered list of names. They might be called a reserve list. And I would say how universities operate them varies greatly. And I think it can be very difficult, even if candidates or have been told that they might be contacted. Universities often don't give out a kind of position on a list of where they are because it can be very difficult to predict whether or not anything is likely to happen as a result of that. It's quite unpredictable, I would say, at this stage of the cycle, and that's very difficult for you and for applicants, and I appreciate that. So there's a couple of places where waiting lists or reserve lists might come into play. So a candidate may have had an interview and be waiting for an offer, and that could be a late interview. So maybe they've had an interview in the last couple of weeks even, and be waiting to hear for an offer if they're going to get an offer. Or they may have had an interview earlier in the admission cycle, maybe in January, December, January, February time, and they may have been rejected, but had an email saying that do they wish to be contacted if at some point later in the cycle the university is in a position to make an offer. And that will be if places become available. So I would say that since COVID, it's been much more unpredictable than it was pre-COVID, and universities have been changing their pattern in terms of the number of offers that they're making, and also thinking about the likelihood of applicants achieving their grades. And at this point in the cycle, when the first UCAS offer holder decision deadline has passed, which is in the beginning of June, universities will be looking at their position and maybe will contact applicants and make them an offer at this stage when they weren't in a position to earlier in the cycle. And I think it's important to be aware that medicine and dentistry courses have a fixed number of places that are funded. And so each medical and dental school will be trying to fill those places as closely as possible. So they can't go greatly over numbers, but they're also trying not to go under numbers. And that's quite a challenge for admissions these, trying to get the number right. And so I'd say the third position at this point is that the candidate's not had an interview, but they've been notified that they may be contacted later. So again, after the June offer holder decision deadline, it may be that universities are looking at their position and thinking, well, they don't have enough offer holders, and decide to hold some interviews at this stage in the cycle. And then they would contact applicants who've given permission to do so. So with all of this, it can feel a bit uncertain and a bit difficult for students and perhaps those who are advising them to interpret the communications and what's happening and what the future may hold. But really the most important thing is for applicants to focus on doing their best in their exams, because whatever happens, this year or in subsequent years, the offer is going to be dependent on meeting academic criteria in A-levels or other exams. So it really is important for them to try and do their best. And I know some students will still be doing A-level exams this week. I don't think they're finished yet. And another point that's, well, there's a couple of other points that are important, that if something unexpected happens, like an illness, it's really important to notify exam boards. They may be able to make an adjustment to take that into account. But also to check university extenuating circumstances policies and see if the university has a way that either the student or someone supporting them, such as the teacher, can complete an extenuating circumstances form that may be taken into account if achieved grades are not what they were hoped they would be. And it's really important that applicants remain contactable throughout the admission cycle from now onwards through to A-level results day and beyond. If a university is trying to contact them, perhaps to make them an offer, that if they've not had one before, then they really need to have a phone number or an email address that's up to date. So I know that can change when students leave school, but it's really vital that they keep their details up to date on UCAS. And I'd also recommend having a nominated contact. That might be a parent, but it might be someone from school to support them, because if we can't get hold of the applicant, then we may be able to get a hold of the nominated contact, and that would be really helpful. I would also say at some point, if applicants haven't got an offer and they're thinking about potentially reapplying for next year, then they're going to need to resit UCAT, which is probably not what they want to hear, having gone through it all last year. But UCAT has to be taken in the testing cycle in the year of application. So if they haven't got an offer now and are unlikely to get a place to start in 2025, then they do need to think about preparing, registering, preparing, and being ready to take UCAT. And UCAT has changed this year. It's different to last year. There's no abstract reasoning section. So again, that's really important for them to be looking at up-to-date, the up-to-date official resources on the UCAT website. There's lots of information, lots of support material that will help them there and explain the new format and the new scoring for this year's testing cycle. So as I've said, there's an important date for offer holders and universities, which is the June offer holder decision deadline, which is the point that any applicants who've been made an offer need to decide whether they're going to accept for firm and insurance. And obviously, if they've had 4 offers, if they're really fortunate and had 4 offers, they can't keep them all. They can only keep 1 firm and 1 insurance. So at this point, when offer holders have made their decisions, the universities will know their position. And as I was explaining, they'll be looking at the numbers and thinking, have they made enough offers? Do they have enough firm offers? Or would they like to make some additional offers at this point in the cycle, or maybe run some additional interviews? And that's where the reserve or waiting lists come into place. So it could be possible that applicants at this point who maybe have been rejected but agreed to be contacted, who aren't holding a medicine offer at the moment, could receive an email from a university offering, either making an offer or calling them to interview. So even though they may be doing A-levels, or even after the A-levels, maybe relaxing and going on holiday, it's really important that they keep an eye on their emails just in case that happens for them. So I'm going to move on to discussing extra and clearing. It is very unusual for medicine, and probably even more unusual for dentistry, to be in extra or clearing. But I also appreciate that there are some new medicine courses and that they could potentially be in extra or clearing this year. Again, it's possible, as I've explained, it's quite difficult for admissions leads, certainly over the last few years, to predict, how offers will be received and whether they'll have the right numbers for their places. So it is possible that there may be some medicine courses in UCAS Extra, which is open at the moment, or in early clearing. And so the best way to find that out is to look on the UCAS website. And also you could check on the university's website, but I think it's probably easiest to go on the UCAS website because it'll have information about lots of different universities on there. And applicants can apply via UCAS if they are not holding any course offers. So if they're really wanting to do medicine and there's a medicine course or a dentistry course in extra or clearing, then in order to apply, they can't be holding an offer, which may be a very difficult decision if they've got an alternative course offer, so a non-medicine, non-dentistry offer, to decide what to do. And I think they need some really careful advice at that point, because that's the UCAS position, and they can add one UCAS choice at a time. So as with any application, they really need to be checking the minimum course criteria to make sure that they're eligible, and shouldn't be applying if they don't meet the minimum criteria, because they would be rejected. So they may need some support in finding that information and checking that they meet the minimum criteria. And then they will need to prepare for interview, because all medicine courses would want to interview, and hopefully you would be able to support them with that. So I'm going to move on to talk about A-level results day. And you, as teachers and careers advisors supporting applicants, will know that the offer decisions will be on UCAS, usually from about 8 o'clock in the morning. So students may receive their medicine offer, but that doesn't necessarily mean they've achieved their grades, because universities may decide to take them with what we call near miss grades, so maybe a dropped grade, but that decision should be on UCAS on A-level results morning. And if students haven't achieved the grades for their firm offer, then there may be an offer from their insurance university if they've achieved those grades. And again, that decision will be there. So if they do have an offer and it is for medicine or dentistry, obviously they'll be delighted and celebrating. If they don't have an offer decision, then it's really important to try and give advice for them. It can be obviously a very upsetting, stressful day, and having someone who knows the system and can offer appropriate advice is really helpful. So I think it's important then thinking about what grades the student has achieved. It's a system where occasionally things can go wrong. So if they have achieved their grades of their firm or insurance offer, but the decision isn't there, then need to contact the university to see what's happened and see if there's been some delay or something in the system's not quite right, but to ask why and to look into that. And then if they haven't achieved the grades for those offers, but they may be in a position, they've got grades that would be competitive for a UK medicine or dentistry course, then it would be a case of looking to see if there are any medicine or more rarely dentistry courses open in Clearing. Again, the UCAS website would be a good place to go for that information. And so, as I say, the good starting point would be UCAS to see if there are any medicine courses in Clearing, and then checking the university websites. And as I've said, looking for minimum course criteria to make sure the candidate is the student's eligible to apply. You don't want to be rejected because you just don't meet the minimum course criteria. And they will be asked for their UCAT results, usually from last year, because this is about starting in September 2025. So it will be using the UCAT test result from last year in order to be comparable to other applicants. And then obviously contacting the university, and should they be successful, they will need to prepare for interview, because the universities will be interviewing imminently as soon as possible after A-level results day. And that could be in person or it could be online. So an alternative position, a different position on A-level results day is the student who hasn't achieved their grades. So they really need advice here from you, and hopefully you'll be in a position to say whether a remark of papers is a realistic option for them. Perhaps they're just below a grade boundary. As a university at Nottingham, we would accept a remark if it gets to the university by the deadline that's set. For many universities, that might be the 31st of August, or it might be slightly later. And at Nottingham, if the remark paper achieves the grades of the offer, we would honour that, and so the student would then have a place to start in September 2025. If a remark doesn't look like a realistic option, then that's a conversation with the student about potentially resitting their A-levels, and if they're still wanting to study medicine or dentistry. And they will also need to resit UCAT, so they will need to think very quickly about applying and preparing for UCAT as soon as possible. Other things that they can do to help their chances, as I've said, it's really competitive getting into medicine and dentistry, and just sometimes being a year older, having a bit more experience, a bit more life, working with the public, but also perhaps thinking about their application, checking they've met the minimum criteria where they're applying, looking at their UCAT score, looking at their GCSEs, and thinking where they've got the best chance of getting in. The Medical Schools Council has a really useful resource with all of the grades and aptitude tests and requirements, for each medicine course. It will be updated for 2026 entry, but it's a good place to start in terms of looking for information. And other things are to do an alternative degree, which Ray is going to talk about, and they should do something that they're going to enjoy. But they could also think about applying for a 4-year graduate entry medicine course following that alternative degree. So many universities, an increasing number of universities, are offering graduate entry medicine courses, and some of the new universities just offer graduate entry medicine. We have a long established graduate entry medicine course at Nottingham. We would take any degree subject for our graduate entry medicine course, but there certainly are a number of courses which are looking for a biological or life sciences degree. So a student who chooses a degree that fits within that kind of subject criteria will have more choices, more options available to them in the future for graduate entry medicine. Many graduate entry courses don't have any A-level requirements and don't ask for any GCSE requirements, so that may help the applicant depending on what they've achieved, and may mean that they don't need to think about resitting A-levels, but could move forward to do another degree. And some graduate entry courses use UCAT, but some use GAMSAT, which is a different aptitude test, is quite different. And so it may be worth you looking at those at the GAMSAT as well and thinking about what that would look like for the candidate. There are some biomedical science courses, and Raya may cover this as well, at some universities where a few candidates may be offered the option to transfer to medicine if they're successful at interview. There's not many universities that offer this, and it's not an easy option because it's usually only for a very highly academic achieving small number of students on their biomedical course, and it does require an interview. But I know some people think about that and think about that would be a way forward for them to get into medicine. You know, people are sometimes very passionate, which is great. I'm a doctor, about medicine or about dentistry, and they're so focused that they're sure that that's what they want to do. Okay, so I'm hoping that what I've covered will be helpful. I've covered quite a lot of things in some level of detail, so I'm very happy to answer questions, but maybe if we hand over to Raya. Claire, do you want to hand over to Raya and then we'll take questions afterwards?
Yes, we'll do questions afterwards. Raya, do you
Yeah.
want to, I think we're bringing up your presentation for you. Yeah,
Yes,
fantastic.
thank you.
Oh, all working.
Okay, amazing. Hi everyone, I'm Raya. And yeah, so I'm gonna dive right in. If you go to the next slide, please, Joanna. Yeah, so I'll be speaking to you guys about the UCAS fifth option. When it comes to an alternative course in medicine and dentistry, you can, as Mandy said, you can only apply to 4 medicine or dentistry schools in UCAS. So the fifth option, you can either be used or it can be like as an insurance choice or if you don't get in, unfortunately. But it also doesn't actually have to be used. You can just leave it blank. A lot of people think that you have to apply for 4 medicine or dentistry courses, or like you have to fill in all 4. That's not the case. You can apply for 3 and then apply for 2 alternative courses as well. The alternative course doesn't have to be science or medicine related. This is a place where you can, explore different options, see, if you want to potentially pursue another passion or another aspect that's related to medicine or dentistry. Yeah, so can we go to the next page, please? Thank you. So when thinking about the personal statement that you'll be applying, one thing that you need to be aware of and you need to ask is whether or not your alternative choice asks for a separate personal statement so that you can concentrate and just write the personal statement for medicine or dentistry, knowing that for your alternative option, you will write a separate statement. Another thing that you need to consider is whether the alternative option will consider medicine or dentistry applicants or will they automatically reject it. Some courses will want an alternative statement, some will just accept you as is, even though your personal statement is geared towards medicine or dentistry, and some automatically do reject it. Yeah. So when it comes to choosing between, like, how do you choose the alternative sciences? You do need to look at the entry requirements, the course structure, the specialisms, there's loads of different bits here, and I know we've not got a lot of time. So if you guys have any specific questions on this kind of thing, we can circle back to it. But basically, the length of study can vary. Biosciences typically offer a flexible undergraduate option. The course structures differ, so you can see if there will be an overlap with some of the medicine and dentistry course units. Maybe that might have you might have an interest there. Could we go to the next slide, please? Yeah, so the A-level requirements for the courses that need one science subject. Sorry, I'm just having a bit of an issue with my slide here. Okay, so yeah, so the A-level requirements here, the courses that need just one science subject are the ones you can see listed over there. And then the courses that need two science subjects, as you can see, the dentistry, medicine, pharmacy, and optometry. So when you're looking at your alternative courses, just kind of know what A levels you're already doing that you can apply for them. If we go on to the next slide, there's also another way to kind of help you decide with this is that there is a bursary. Oh, sorry, can we go to the next slide, please? Yeah, the NHS Learning Support Fund. So effectively, this is a bursary, not a loan. So students don't have to repay it back, but it doesn't apply to every single healthcare course. So this can help you decide on, this is going to be another deciding factor for what course you want to do. So the NHS Learning Support Fund is £5,000 per academic year, an extra £2,000 for parental support. Any travel and temporary accommodation can be covered as well as any training courses that you need to do. So the courses at Uni of Manchester that will support this are dental hygiene and therapy, midwifery, nursing, speech and language therapy, for example. Out of those ones on the post-it note, it is midwifery that will accept as an alternative. So yeah, it might be a little bit difficult if you're applying for like dentistry and you want to apply for dental hygiene and therapy as well. You won't be able to go into that one. But that is obviously just at Uni of Manchester. It might be different in other universities. We'll go to the next slide. The one after that, please. Sorry. Sorry, there's just a bit of an issue with the slides. Could we go again? Could we go to the next one? And again. I'm really sorry. I think Jose has sent in the wrong slides altogether, and these are just like the longer one.
Okay, don't worry.
Yeah.
We'll keep going.
Yes, please. I'm just like, oh, this is not the same. Yeah, if you could please keep going. This is the one. So if we just click on it, so the way to decide which courses you want to do, I'm a bit frazzled because I wasn't expecting them to be all wrong. Basically, looking at which courses you want to do in healthcare, you can decide based off of like the place of work, the type of patient, or the type of work you want to work that you will be doing. So depending on the type of like science related course that you pick, if you go to the next slide, it should take the box down. Place of work can be that can be considered is whether you want to work in a hospital, in the community, the high street, for example, as a pharmacist, in schools, whether that's like in public health. If we go again, the next slide should take off that. So this is the type of patients you'll be working with. If you go for nursing, it'll be you can work with children, you can work with adults. Routine patients, those are like, again, and it could be nursing as well. And the next slide, please. The type of work that you might be doing. So whether that's going to be outreach, advice, research, make and build, diagnose and treat. Make and build is an interesting one. So an example of that can be dental technology, which is where you're actually making dentures and basically all of the functional materials in a lab. You won't necessarily be working with patients, but it is another aspect of dentistry. It's actually my background, so that's kind of what I did in Cardiff Uni. We don't provide it at Uni of Manchester, but it is another alternative that you can do. It's not an alternative you can apply for at the same time as your fifth option, unfortunately. But as you can see, there's lots of different roles in healthcare. So you can make your decision in that way. What kind of work do you want to do? Where do you want to work? It's not always just medicine or dentistry. There are other ways to kind of working in care. Could we go to the next slide, please? So these are the These are the courses that we have at Uni of Manchester that will reject the application, unfortunately. So an automatic rejection will come from the post-it note on the left. So dental hygiene therapy, nursing, optometry, pharmacy, psychology, speech and language therapy. Now, the reason for this is because there is a lot of people that do apply to these courses thinking that they want to go to the next one. And we do want students who do apply for these to stay in these, professions and not kind of want to jump across. The courses that will ask for as a separate statement are audiology and midwifery. And the public health with us, you don't really need to write another personal statement. They're okay with you applying for medicine and dentistry and getting a personal statement through to them with that. With our university, for our medicine course, we don't necessarily use the personal statement as the deciding factor in whether you're going to get an interview or not. So the personal statement there is usually more for maybe some questions asked at interview level. So when it comes to those courses that ask for a personal statement as well, and you want to apply and kind of not necessarily just be trying to broaden it out a bit, then there are some universities like ourselves who don't necessarily use the personal statement as a deciding part of the application. Again, you would have to check with the school where in your application that is the case, because it is different for each school. If you can just go to the next slide, I'm going to talk a little bit about biosciences, same as Mandy did. So with biosciences, what we mean by that, it's split into kind of two. We've got biological sciences and biomedical sciences, the coin with two sides. The difference between the two is that with biomedical sciences, it's mainly a focus on the human body, on the human life cycle, basically. So anything to do with the human system. And then biological sciences is a crossover of any living organisms. Now, these aren't as like a binary choice. There is a crossover here, but this can kind of help with students deciding what kind of thing they're interested in already, and can kind of give them a better idea of what they'd like to do in the future. If we go to the next slide, please. So yeah, I've not got this slide either, but as I said, it's a standard common 3 years, as with any other course, but you can extend it if you wanted to do a modern language, entrepreneurship, or a year in industry. So this will make it a 4-year course. Same as what Mandy said, we don't have a transfer to medicine with our biosciences courses, but we do have the option to apply for graduate entry medicine afterwards. If we just go to the next slide. And again. There we go. So with our biosciences, the entry levels, if you're doing 2 sciences, including biology, chemistry, physics, or maths, depending on whether you've been predicted, your predicted grades are 3 A's, then you'll get an offer of, or more, you'll get a minimum offer of 3 A's. If you've got predicted grades of AAB, then you'll get offered an AAB to get in. The reason for this is because, where we've got someone who has, if we just offer everyone an AAB, it just does come across as less competitive. So we're just trying to make sure that students really do want to do these courses. Yeah, with the 3 A's option, that's only if you've done 1 science from the biology, chemistry, physics, and maths, and then the other sort of courses that you're doing are geography, psychology, or environmental studies, or PE. In that case, it will be a 3A offer. If you can go to the next slide. So our policies here, again, this slide is a little bit old, but the biosciences policies are that you do need to provide an alternative personal statement. Currently, yeah, we will ask for an alternative personal statement. Other unis, again, like I said, they might have a transfer system. We don't. You can apply for graduate entry medicine afterwards. So with our graduate entry medicine, the difference between the medicine course and the GEM course is that the first 2 years of medicine are kind of bunched into one with the graduate entry one. And then the second and third and fourth year are the same as a normal 5-year course as well. So yeah, that was yeah, thank you very much. This is, if you want any more information, you can click on going through to BMH Choosing University, and we've got loads of resources there that'll give you a little bit more. I massively apologize for the bit of a technical problem there with the slides, and a bit of a whistle stop tour. So if you guys have any questions at all, please do ask. And
No, thank you, Ray. It's nothing worse than sitting down to do a presentation and realizing the slides are not right. So you have my utmost sympathy. I
yeah,
just
thank
wanted
you.
to add something myself about transfer courses. I think it's really important to note that in some places, they won't guarantee the number of students able to transfer into medicine. So what is actually happening there is there may be places if people don't complete first year of medicine. So it will be a link in for those if they've got, because the numbers are so tightly controlled, it's a way of filling those numbers from if people drop out in the first year. So it is a risk, it's a calculated risk, because you have to, you know, at some years everybody will move from first year to second year of the medical degree course, and maybe there won't be any spaces left. So just to bear in mind that, you know, look at the policies for that course really carefully. Actually, I think to summarize everything that everyone said, look at the entry requirements really carefully. That's the key takeaway. So we've got some questions, which is really good. Mandy, I know that you have a foundation course. So if you don't get the grades, could you apply to foundation years?
So many medical schools, in fact, I think at least half have a foundation year or gateway year. They usually require lower GCSEs and lower A-level grades. They would normally be for students who meet the university's contextual or widening participation criteria. So whether or not you could apply would depend on whether you met those criteria. So not only do you have to look at the standard entry, the normal entry requirements, but you also need to look at the university's contextual criteria. So for example, at Nottingham, it would be attending a state school and living in an area. There are many other things. You have to attend a state school. You have to be a UK home applicant, and then meet one of the other criteria, which, for example, might be living in an area that the government has said is somewhere that people are less likely to go to university. So we wouldn't allow applicants to apply for both our foundation year and our medicine course in the same year of entry at the beginning. So you can't kind of hope that you could use our 5-year course as your firm and then our 6-year course insurance. We don't allow for that. You can apply for one or the other. But if, yeah, and then it would depend on whether we wouldn't be expecting to be in clearing. So the option of not getting into our 5-year course and then applying to our foundation year in the same year wouldn't be an option, I don't think. But if it was the following year, you know, if applicants met our university contextual criteria, but they hadn't met the A-level grades, which say our contextual offer for our 5-year course would be the usual one is 2 A's and a B, but our offer for our 6-year foundation year course is 2 B's and a C with biology and chemistry. So if the applicant had met at least 2 B's and a C, said they got 3 B's with biology and chemistry, they don't meet our university's 5-year course, so they wouldn't be able to apply for the 5-year course the subsequent year. But if they met the university's contextual criteria, they could apply to our foundation year course. Does that help?
Fantastic, thank you. Do you have a graduate entry course for dentistry at Manchester, Raya?
Sorry, could you repeat that, please?
Do you have a grad entry dentistry course
Not for
at Manchester?
dentistry. No, not for dentistry.
And Mandy, you don't do dentistry at
No, we
all,
don't.
do you?
There are a few
No.
graduate entry dentistry courses, aren't there? I think King's has one, for example. So there are some, but not many.
Right. Yes. So, I mean, just a note on graduate entry courses in general, they are competitive to get into. that's not to say that they're unrealistic as an option at
So
all.
Claire, we
But
would say our
they,
graduate entry course is no more competitive to get into than our 5-year
okay,
course or our foundation year. They're very similar at Nottingham.
okay. Okay, and in general, I think they are a little bit like the national picture, maybe a little bit,
Yeah.
but you know, there's they will vary, and you know that's the good thing about applying to medical or dental school. Actually, there's plenty of options. These days, there's even more options with new schools coming online and new courses coming online. So that's you know a really good thing. So let's try. What is a firm or insurance offer, Mandy?
So if you have some applicants may be very fortunate to get more than one offer. They could get 4 offers for medicine or dentistry, potentially. And then they would then have to decide to reject a couple of them because you're only allowed to keep 2 offers in the UCAS system. And that's where offer holder days come into play, or looking at the websites and checking more detailed information about the courses and thinking about where you want to live, how far from home you want to be, that sort of thing. But eventually, usually in June, the first week in June, offer holders are going to have to decide on a firm and an insurance offer. So this will depend. It's an individual preference. I would say the firm offer is probably going to be where you most want to study medicine. However, I can understand, and then the insurance would be your second, your second choice, particularly if the grade requirements for both courses are the same. However, I can anticipate that if you've got offers and they've got different grade requirements, then it might be strategic to choose as your firm offer, your first choice. Firm means your first choice, the one with the higher grades. And then if you don't get that, then and your insurance offer is lower grades, then hopefully you're going to get the grades for your second choice, which is your insurance. So firm is the first choice and insurance is the second choice. The difference that it does make, for example, at Nottingham, and this may be the case elsewhere, is that if you want to apply for accommodation, you have to be firm with us in order to apply for accommodation. So it's not just about it being your first and second choice, but there are some other things to think about as well.
Okay, Raya, I've got a question about UCAT and dentistry here. So the person is asking, if you don't do as well as expected in UCAT, but have A star AA predicted grades, as well as 7 to 9 GCSE grades, is there a chance you will still be accepted to dentistry? Now, I'm aware you probably only talk about Manchester in this context, but I'll ask Mandy afterwards for her perception on medicine as well.
Unfortunately, I can't answer the acceptance for that. If you haven't been given an offer, I can't say, but I would urge you to get in touch with the school for our School of Dentistry. If you get in touch with the admissions, they'll definitely be able to answer that for you. Again, it's not something that myself from
Yeah.
the FBMH recruitment team could be able to answer, unfortunately.
Yeah, I suspect it will come down to the variable use of UCAT across institutions and how it's used. And I think Mandy might be able to unpack that a bit because I know she's heavily involved with UCAT. So go on, Mandy, tell us.
Okay, so I would say each medicine and dentistry course uses UCAT slightly differently. There is some information on Medical School Council's website, but you're really best to go on the university's website and look at their selection process. So I can tell you about Nottingham. It's probably difficult for me to be specific elsewhere. But if you're applying, so this would be at a different stage of the cycle. And if you're, if you'd got your UCAT score and maybe your achieved A levels, or we don't look at predicted A levels at Nottingham. So being predicted A star AA wouldn't make any difference to us at all. We select for interview on GCSEs and UCAT. And if you look at our website, then you'll see that the UCAT is quite an important part of our selection process through to medicine. It's quite heavily weighted, but we don't use the overall score. We score the different sections separately. But we would expect you to have an SJT 1, 2, or 3. We reject band 4s. So there may be other medical schools that only use the UCAT as a much smaller part of their selection process. Perhaps they select on predicted A levels and GCSEs and maybe some contextual criteria. And maybe the UCAT might only be used as a deciding factor or at a later point. And there are a few medical schools that will accept SJT band 4. So you really, if you do get an SJT band 4, you really need to check carefully what the university is looking for. So there's no easy answer to that, but it does mean you have to check each university's website, I would say, and try and work out what matches your achieved grades and your UCAT as closely as possible.
Yeah, and I think that that's probably a bit of a similar picture for dentistry. That I think the key message is that universities use UCAT in different ways. So it can be ranking, it can be threshold, it can be tiebreaker. There are lots of different ways of doing it. So, you know, it might look on the surface that you've got these fantastic predicted A-level scores and fantastic GCSEs, but if the school is putting a lot of weight on UCAT, that's what they're using to make their decision. I hope that we've managed to get across that this is all very complex because the numbers are really strictly controlled. So it's the decision making is really hard for teams on this. I understand it's very hard for applicants as well, but we're not doing it just because, you know, we fancy it. It's because it's hard for both parties. Mandy, can I make you work a little bit harder on UCAT? Because as you mentioned, UCAT has changed. So that will mean that previous, you know, if schools say what their previous threshold was for UCAS,
it will be
might
different.
not match over.
It will be different. I think, I mean, at Nottingham, I would say we can't predict from one year to the next what UCAT score would get you through to interview. We combine ours with GCSEs, and I will always say that at every open day. It has to be the most frequent question we're asked. Some medicine courses in past years have had what would say a fixed threshold for UCAT. Again, that could change from one year to another. They might change the threshold, but it will definitely be different this year in the 2025 testing cycle for 2026 entry, because abstract reasoning is no longer part of UCAT and the overall scores have changed. So the maximum score that can be achieved for UCAT is different this testing cycle. So I would anticipate that most, if not all, medical schools are reviewing how they use UCAT and what thresholds they may use in the selection process. So it's really important for anyone applying for 2026 entry that they look at the information that is for 2026 entry, both on UCAT and on the university's website. So they're looking at the correct up-to-date information. And UCAT have prepared lots of excellent resources for visiting the UCAT test this year. So do go on their website if you're needing to take UCAT this year, this testing cycle.
And I'm going to give everyone a briefer by sort of related to what Mandy said. We've got a question. Do you still resit UCAT even if you got a good score? Yes, you have to sit the UCAT. You have to apply with the UCAT score of the cohort going into medical school or dental school together. Because as Mandy said, like this, if you sat it this year and you sat it next year, you'll be taking slightly different test. And it's always about your performance in relation to the cohort who took the exam that year. So I know that it feels very mean that we make people resit the UCAT, but I'm afraid you do have to do it, even if you. But I think the good news is if you do really well one year, you're likely to do really well the next. You obviously know how to do the test. So.
But Claire, you can't resit it in the same cycle, can you?
Very true. Yes. Yeah. Kerry has been wanting this question asked. So if a student is applying to Nottingham and they're accepted on a gateway course on their predicted grades, but they get higher grades, do they have a choice to not do the gateway course, or do they enter the gateway course? So
they would normally enter the gateway course that they've been offered. So I can't say this ahead of time, but I can say that in past years, sometimes I've had places on our 5-year course. And if I've had graduate entry student, gateway entry students who've achieved the grades for the 5-year course, but also would have achieved the interview threshold for the 5-year course, So that's 2 things they've got to have achieved. So no, actually, there's 3 things. They've got to have achieved the GCSEs for the 5-year course, and the interview threshold for the 5-year course, and the A-levels for the 5-year course. Then if they've achieved all of those and we've got spaces on our 5-year course, then they might get a phone call from me on A-level results day saying, would you like to do the 5-year course rather than the gateway year course? Which is why it's very important to keep contact details up to date and to have a nominated contact in case you're somewhere else in the world and I can't get hold of you. So that could happen, has happened in past years, but I can't say ahead of time whether that would happen this year.
Thank you. Raya, at Manchester, are the odds of getting an offer better if you apply with achieved A-level grades?
I'm afraid I'm not. I couldn't say. Again, please, the best thing would be to email the admissions for dentistry on that. I'm not sure on the answer, I'm afraid.
It
No,
wouldn't
that's
make
okay.
any difference at Nottingham because we don't look at that.
So I think they would treat them if they're using predicted and predicted, they would treat achieved and predicted the same. But obviously, you've got those scores, so you don't have any anxiety on results day, would be my spin on it. But remember, Mandy just said they don't look at predicted A levels, they don't look at achieved A levels at all.
So I think the important thing to be aware of is that then if the candidate is successful at interview, they will be made an unconditional offer because it's unconditional on A-level grades. So if someone applies with the grades that they're going to be offered, so for example, if they applied with 3 A's at A-level in biology, chemistry and another to Nottingham for medicine, we wouldn't look that before interview, but when the offer was made, it would be an unconditional offer because the grades are already achieved. Whereas if the grades aren't achieved, it's a conditional offer dependent on getting the exam results.
Mandy, you were at a school that puts quite a lot of emphasis on GCSE grades in that context. So do you need at least 7 GCSEs at grade 7 for your school?
It varies depending on the 5-year and the 6-year course have different grade requirements, and we will accept 1 resit in biology, chemistry, maths or English if applicants don't meet the minimum requirements. So we have a minimum requirement, but then we score more in the selection process. So I really would advise people to look at the website for the detail.
I'm going to give everyone a rest and I'm going to answer this one. Can you transfer between universities or courses? Now, courses will be up to individual universities to decide. So I'm not going to, that you'll get there and you'll see if that's possible. It is very difficult to transfer between medical degree courses in the UK. And the reason for that is that the job of a medical school is to deliver doctors who are fit to practice and have met all the outcomes for graduates set by the GMC. And those are tightly mapped into a curricula. So they have to, every single outcome and outcomes for graduates is mapped into the curricula. Each curricula is bespoke to that medical school. So it's very, very difficult to get the guarantee that those outcomes have been met if using 2 different course types. So that really goes to the point. Please go to a medical school that you're going to be happy at. I understand sometimes there's not a great deal of choice if you have, particular things around your grades or that sort of thing or what you studied, but it is really important that you don't pick a medical school thinking, oh, I'll be able to transfer out if I don't like it. It will be a 5 to 6 year commitment to that place. So I just really wanted to make that very clear for people. It is really important that you go somewhere that you're going to enjoy being at. Obviously circumstances change and that, but it is very hard to transfer. Raya, as you think about your university, are you one that accepts resit GCSEs? And do you know if you don't, is there a particular reason why?
I'm not sure on whether they accept research GCSEs. Again, I'm very sorry. This is more within admissions, and
Okay.
I don't see why they wouldn't, but I couldn't say for definite.
Don't worry. Mandy, do you accept resit A levels?
We do for our 5-year course, but not for the gateway course, because our gateway course requirements is 2 business C, so we think it's already quite low. But we will accept a resit for our 5-year course, and the details of that in terms of what grade you may have needed to have had and how long ago are on the website. But what we would ask for is the same grade, so we're not asking for more.
Yes.
So, you know, if it's 3 A's as our standard offer, we wouldn't be asking for more than that. So yes, we will accept resits, and it wouldn't disadvantage the applicant. I'm not looking to see if they're resitting, you know,
Yeah.
when we're selecting for interview. It's not something that we look at, but obviously they're going to need to achieve the grades. Should they be successful at interview, made an offer, they will then have to achieve those grades.
Well, I'm going to finish there. I'm sorry that there's still a few questions that we haven't got to answer, but I think that we've been able to answer a fair few, and I am going to finish us dead on time, I think, once I've done my thank you. So thank you so much to Raya, and thank you to Mandy. This webinar will just cut. That's how it works. But please, we are saying thank you and easing you off in a nice way, really. It's just the way the webinar system works. But thank you so much for joining us today. And thank you to everyone for asking such good questions, because that was really enjoyable. Thank you. Bye.